Welcome to Engaging Aging with Erin and Lauren.
Join us as we share laughter, tears, and demystify the realities and silver linings that occur later in life. You are in for a treat today. If you are an older adult or supporting an older adult in your life and noticing physical changes and feeling a little stuck, and maybe that it's supposed to be painful and difficult as we age, you're here to learn that there's so much more you can do with easy, simple tips, not only to increase your overall physical well-being, the benefits of increased muscle mass, bone density, flexibility, minimizing fall risks, but also how all of this physical improvement impacts our cognitive abilities. We talk about neuroplasticity, neural pathways, and all the exciting things to help you physically live your best life later in life and not become a victim to the lie that aging is supposed to be painful and all about decline. So Josh Kaplan, doctorate in physical therapy and our expert content provider within the Engaging Aging platform, joins us today for an engaging conversation around all things physical health. Hope you enjoyed as much as we did. Be sure to like and comment and follow, and details on how to connect with Josh will be in our show notes. Welcome to Engaging Aging. I'm Erin DiCarlo.
And I'm Lauren Watts.
We believe life gets richer with age, and we're here to prove it.
We bring you real conversations about aging well, living fully, and navigating this journey with confidence.
So let's dive in, because aging isn't something to endure, it's something to embrace. Okay, welcome to the Engaging Aging podcast studio, Josh.
Thank you. Thank you so much, Erin. I'm so happy to be here.
So to our listeners, this is Josh Kaplan. He is a doctor of physical therapy and the owner and founder of Envision, which is this amazing platform giving anyone in need of physical therapy easy access to consistent movement, coaching, training. And I'm so excited to dive in with you today. So tell us a little bit about how Envision came to be. I know your background is you dabbled in all types of physical therapy and landed somewhat in the older adult space, but give us a little background on how it all came to be.
Yeah, so believe it or not, I've had this idea in my head for many, many years, actually over a decade. This idea was sparked in college, and I basically wanted to help people move more and feel better because we all know that exercise and movement is really helpful in our mood, in our physical form, obviously, and most importantly, our emotional well-being. So after I went through PT school, I moved out to San Francisco and I worked at a clinic out there. And obviously in San Francisco, you come across all these incredible people who are starting companies. A lot of them are younger. They were even my age at the time. I was 24. And you start asking yourself, well, if they can start a company, maybe I could start a company.
I love that entrepreneurial thinking. It's just who you are. Like you said, for a long time, even when you were young, that was something about yourself that you knew. There was that thread. And then to be able to witness it in other people sparked that inspiration for you. But you started in more sports medicine, correct? When you went out to the West Coast.
I did. And just a note on that, because it is really interesting, and I will go back to sports medicine. So I used to have insomnia when I lived out in San Francisco. And what I would do to try and get all these thoughts out of my head is I would grab my laptop and just type out all the things that were flowing through my mind. One day, I was organizing my laptop when I was actually visiting a friend in Hawaii, and I woke up really early because of jet lag, and I was like, well, I might as well organize my laptop. And I found this document that I labeled the San Francisco Project. I had not looked at this since my insomniac days, which were about 4 years before this trip. And I opened it up, and basically the exact plan for Envision was there. And I was like, this is crazy. This is crazy. So yes, it's
intuition to tap into that. And in those moments of insomnia, I think we have the most clarity because you're in that like semi-unconscious state.
yes.
Your truth can really come through.
Yeah, I mean, it was crazy to me because, yeah, your mind works differently at different points throughout the day and night. And to know that these ideas had kind of been in my head, even though during the day they weren't so fully and clearly formed, was a huge surprise to me. Yes, but yes, so you mentioned kind of my path. So I started at Boston University when I was 18, and I did an athletic training and physical therapy combined program. So what that meant was that I did a lot of athletic training clinical rotations with sports teams at BU, Harvard, all the places around Boston, and I kind of got my feet wet. I learned how to tape ankles. I learned how to do quick screens on the field. I learned how to splint fractures, all the things that you
All
do.
the exciting, sexy part of physical therapy that young people want to do.
Yeah,
Yeah.
yeah, sometimes sexy, sometimes not so sexy, but either way, you learn a lot
But
when
you
you're.
space, the part that, like, just went right into geriatrics. So it's a
Yes.
good thing you did that first. You did the exciting part first. Okay.
Yeah, and yes, that's actually a great point. And I enjoyed that a lot. I went to PT school. I got my degree. I started working, and my favorite patients were these middle-aged and older folks who were just, they were visiting a friend up in New Hampshire over the weekend, and their back was bothering them. And they're these great people. They're what you would consider everyday normal people. But these are the people that I enjoyed learning about and enjoyed working with and fixing, right? Or they're helping to heal, I suppose is the better term. And I just felt a strong desire to see how much of their life and physical function I could address within just kind of this siloed area of physical therapy, right? So what started happening is people would come in, they talk about whatever acute injury we're treating, but then the more you get to know them, the more you learn about the types of things they want to do in their life. And I felt that the setting that I was working in was limited in that sense. Physical therapy is incredible for addressing an acute injury or pain or anything post-op, and you need it. And I enjoyed doing that with people. However, I found myself being more drawn to this idea of helping someone become the person they want to be, physically, mentally, and emotionally. And a huge piece of that is the confidence they have in themselves and their bodies, right? And then,
And so young to figure that out. I think so many people come to that as practitioners, at least that I've witnessed in time, like so much later in their career, for you to see that, yeah, we're more than just our physical diagnosis. There's this whole wheel with different spokes on it that contribute to our overall well-being. And the physical piece is just a piece. And then even for that to be the best it can be, we have to address these other areas. And that can't be necessarily done in an outpatient clinic because you don't have access to your own unique environment and everyone is different.
yeah, yeah, that's exactly it. And I think, this idea began to germinate in the outpatient setting. And then I started working in nursing homes. So just quick overview. I moved out to San Francisco, worked in an outpatient clinic there for a year and a half. Then I did travel physical therapy, and that's where I got exposure to skilled nursing. And a lot of PTs are not excited to work in skilled nursing. Some say that's where your skills go to die. I worked in skilled nursing during COVID, and a little bit before, and I so thoroughly enjoyed, as you just mentioned, getting to know these older folks and their stories and feeling like I wanted to help them beyond just these kind of physical limitations.
And witnessing how their lives can improve so much more drastically than other types of patients when they have quality support and treatment. I mean, essentially, like you really get to see, I'm sure, the fruits of your labor with an older adult patient, right?
Yes. And it wasn't until I started working in nursing homes that I realized that even a 90-year-old, even like a 95 or a 100-year-old, can actually see improvements in strength, balance, pain, and therefore function. And so that is really where this idea of starting Envision in its current form came to be. Because the question I kept asking myself is, what can someone do, or why aren't people doing 10 minutes of movement a day before they end up in physical therapies or skilled nursing?
To do or how to do.
Right.
So give us an overview. Obviously, I know it. We have, we're not only referring professionals, we've also used your program with great results. So tell the listeners, what is Envision? What is the product and service?
So Envision in its simplest form is delivery of a personalized movement program. Okay, so how do we do that? We start with an evaluation We want to see how you're moving. We want to hear about your health history. We want to watch you walk, get down on the floor, look at some range of motion. And we can actually do this virtually, which is really cool. We do some of our evaluations in person in the Boston area, but the vast majority of our clients are evaluated on Zoom.
And you have clients all over the country.
Yes, we do have clients in multiple states at this point. That they're more geared towards personal training, right? We're kind of a personal training company with the expertise and lens of physical therapists, and that just helps us approach someone from kind of that musculoskeletal nervous system first approach.
Because so often my experience has been witnessing clients, maybe there was a fractured hip. And so there's limited exercise covered through Medicare for, let's say, the first 4 to 8 weeks. At home, they're just focusing on the hip area and then services end. And it's so hard for us to then watch that person have a decline in other areas on their body or at home and not be able to get ahead of a future injury or see even more optimal results. So this bridges that gap for people.
100%. Yeah. So again, physical therapy, I love the profession. I recommend it to anyone in pain. I think if you have a good physical therapist locally, that is one of your best allies, especially as you're getting older. But yes, you highlighted one of the enormous gaps our system faces, right? They're not necessarily working on their posture. Ideally, they're working on their core, but they may very well not be working on their core. It really depends on the PT you get. And there's some PT clinics that will have you evaluated by a PT, and then you're just doing exercise with someone else. And again, that person, that individual might be great, right? But that individual has not necessarily undergone all the schooling and education that a doctor of physical therapy has, or even a physical therapy assistant. You're not even always getting a physical therapy assistant to help you in some of these settings, right? So yes, what we aim to do is address the whole body. So we're going to look at your ankles, knees, hip, core, back, posture, balance, all these areas, and we're going to tailor a program to address all of these areas. And we do it in a way that eliminates so many of the common barriers. You mentioned a few before, Erin, right? How am I not going to hurt myself, right? How is it going to be safe and effective? What do I do? What do I do, right? Like, not everyone is an expert in the musculoskeletal system. Yeah. And so we start with a 5 to 12 minute program. And
It's walk this to the overwhelming. I say is it feels like it'll be a lot and exhausting. And so 5 to 12 minutes for someone to start to tiptoe in the waters. And then I would assume when they start to feel better or see results, they have that internal motivation to continue on.
That's what it is. So many of our clients have been unsuccessful with other models, right? They've tried to go to the gym and get a personal trainer. They've tried to do classes online. They look up YouTube videos. And again, I have no bad things to say.
Great supplemental.
Yeah, against these. Yes, but people have found success with us because they're able to do it consistently and they see the results, and that is intrinsic motivation to continue. And we meet with them throughout the months. We do the most common option is twice a month, and we progress their programs. And that ensures that they're progressing safely and effectively. They're stronger than they were 6 months after starting with us than when they started with us. Even again, if they're 90 years old, right? We have a few 90-year-olds, and it's all delivered via our app. So you do it at home. And again, you are assigned a trainer, and that trainer progresses you in a safe and effective manner, develops a relationship with you, gets to know you to make sure that you're seeing the results and achieving the goals you set out to.
What I love about this is it takes us out of victimhood. I have seen so many people kind of their aging narrative is like, well, I'm old, so I'm just have to live in pain because that's what was molded for me. I saw my aging parents decline, and this is just what's in the cards for me. But what we know as professionals working in this field is that's not true.
Yeah.
That we have witnessed other people thriving, improving, and changing later in life, and you can too. And I think that's the beautiful thing. And our goal, obviously, here at Engaging Aging, one thing I haven't mentioned yet is that Josh is going to be an expert content provider within our Engaging Aging educational platform with lots of different modules and education and information. But that's the goal here, is to let people know you don't have to live in chronic pain. You don't have to be victim to what that age narrative is. And our neuroplasticity can increase as we age, our physical flexibility and muscle mass. So if you had to pick, obviously within our Engaging Aging educational platform, we'll go through all of these topics in great detail. But what's kind of the one thing, as an expert working with older adults in your program, that you would say, like, this is the thing that if we could work on more with people, or this is like the most interesting thing we see with aging, what's your top thing and some tips around how people can address?
Muscle, muscle, muscle. I heard a quote recently, and someone referred to muscle as the organ of longevity. So not only does it help regulate blood sugar levels, not only does it help our cardiovascular endurance and strength, but muscle is protective, right? So the more resistance training we do, the stronger our bones can get. And we actually have a client that saw a 6% increase in her bone mineral density at the age of 75, and she's not taking Reclast or Fosamax, which are the two most commonly prescribed drugs for osteo. Yeah, this little lady, she's awesome. She's on our website, so you can take a look. She had a little testimonial. Yeah, she is now doing 18 push-ups, squats with 15-pound dumbbells, step-ups, you name it. We got there working over the course of 3 years. So, none of this happens overnight, but she's confident, she's strong, she can do the things she wants to do. She went cross-country skiing the other weekend with her husband, and her husband was complaining about how sore he was, and she just flew right through it, or I guess glided right through it. And so, yeah, so I would just say anything you can do to increase your muscle mass is going to protect you, even if you do fall, right? It's not like anyone has figured out how to prevent falls fully, but if you have more muscle on your frame, number one, you're going to be less likely to fall. But number two, you're actually going to be protecting your bones, and you'll likely be able to get up.
That makes so much sense to me.
Yeah.
Tell me a little bit about, so if I'm an older adult and I don't have weights and, a gym area in my house, and you're telling me to do, this type of exercise, give us some examples of how this can be easy and manageable in your own home without kind of a classic gym setting.
Yeah, great question. So obviously it's going to depend on if anything is bothering you, right? So let's say you have knee pain, but you still want to work on strengthening your legs, and you're just worried you're going to hurt your knee when you strengthen your legs. So one of the most common things we start with is just a simple wall sit, right? So you put your back against the wall, your feet are maybe 8 to 12 inches away from the wall, and you just slide down until your knees, if they hurt, start to bother you a little bit, and then you can just come up a little bit from there, and you hold that position, right? So you're starting to activate these muscles. There's blood going to these muscles, and these muscles are resisting the force of gravity in a very safe way, right? You're not going to fall because the wall is right behind you and you can easily stand up. But that's a very good way to introduce a leg strengthening or quad strengthening exercise. So simple. From there, you can grab your counter and just start to kind of sit back a little bit into a little mini squat. Again, you're watching out to see if anything's bothering you. If nothing's bothering you, because you're holding on, you can go down as far as you want. A simple sit to stand, right? Something most of us do every day, multiple times. If you can try and do a sit to stand using one arm instead of both arms, or even no arms, if you have that amount of strength, that is one of the most fantastic functional exercises.
Actually, I think Instagram the other day, this reel. He was a physical therapist. He was working with a 105-year-old woman. Did you see that?
I don't think I saw this
So
one.
he set up his camera every day. She's 105, everyone. So I don't want to hear the ages. Please stay up the ages.
Yeah.
I'm doing this move. And he set up his camera every day. So the first day he went to see her, she was a full support. So he had to she grabbed around him and they stood up. And it was probably, I don't know, 30 or 40 visits that he was like time lapse.
Okay.
And by the end, this woman was standing up, sit to stand on her own.
Yep.
At 105 years old, her muscle mass increased. She was able to have the ability to do that and increase her strength.
There you have it, folks. 105. 105. And this woman was able to increase her strength and function. That's amazing.
It is amazing. And, the work we do to increase our own well-being is such a great way to change the trajectory and the reality for future generations. Meaning, if you're listening to this right now and maybe you did not have quality aging
Modeled
for you growing up, and so maybe your mindset does need to do, by the way, your mindset is never set. We can change.
Absolutely.
Program on that. So when you haven't had it modeled for you, but you can do the work in your lifetime, you now just changed the epigenetics in your family for future generations to
So I think that idea that you just hit upon, that idea of changing the mindset, changing your epigenetics, changing how future generations think about this is incredibly powerful. In my very own life, in my very own not short, but
you're young.
yeah, I've been a clinician for like 9 years now. In just a couple months of working, I have completely changed the paradigm on how I think about strengthening and rehab and all things around that because I've seen this incredible ability and adaptive nature of the human body, specifically the musculoskeletal system and nervous system, to change and learn and develop at this late stage of life. It's incredibly powerful.
It is powerful. And I believe it's how we're going to change the narrative of aging in America. If you've heard me once on this podcast, you've heard me twice or a million times say this. Ageism, I believe, is the last fully socially acceptable form of prejudice in our country because it's not true. The things that are said about older adults is not truth across the board. And yet it's just assumed that when we get old, we get forgetful and our bodies fail us and we live in pain and we can't do X, Y, Z.
Mhm.
That's not true. And we just need to look out at these examples to come together to say, we don't accept this. And hey, there's something you can do about it. So that's why we're so thrilled to have you on today to help reinforce that truth for others. So one thing I feel like a hypocrite sitting here. I've always been athletic. I've always been active my entire life. I played sports in high school and college. I've been busy with children. And then about 3 years ago, so I had a gym membership. I went to the gym somewhat regularly and then pandemic hit. I purchased a Peloton and I was really great with consistently using it. And then 3 years ago, we moved. And it's so interesting to me when I look at my situation, like third party, that I think just because my household and my schedule changed, I never got back into it.
Yes.
It's weird. And now my husband says, just do 5 minutes or 10 minutes. It's like, because I almost feel like a failure that I can't go back, just dive back into the level of
Yes.
activity I was doing before, that I'm just avoiding it.
So many people had to change a routine during COVID, obviously, right? And I'm really glad to hear that you got the Peloton and you were using that for the first couple of years.
It's collecting dust now, but continue.
Yeah, or used to hang clothing. Yeah, but that change in routine knocks you off course. And I think the insidious thing about this is you're not going to notice it obviously in your day to day. When you're walking around, when you're driving to work, when you're working, when you're doing whatever you're doing on the weekends. But then, if you go to pick something up off the floor, or if you're going on an especially long hike on a nice summer weekend, you're like, oh my God, right? And things might start to act up, right? So it's difficult to internalize the importance of doing something if you're not feeling the effects. And I think that's why so many people get away with not moving for so long. It's because it's just not made apparent in our day-to-day lives how important it is to move and exercise. And I also wanted to touch on this idea of like exercise. So we like to talk about our initial programs as movement programs because exercise has a connotation that can be negative for some people, intimidating for a lot of people. And what we're really about, and what I think a lot of people should be about, is this idea of just moving consistently in the way that your body needs to feel as good as it can feel. So yeah, Erin, I think your case is by far the majority of people who might be listening to this and those that aren't listening to it. It's a matter of figuring out your path back to it. And, obviously we'd be happy to help you with that. There are other ways you can get help with that. But yeah, and then once you start.
We recently took a trip to Miami for a professional conference, and I threw my back out the night before we left very severely. It was awful.
Yeah.
My husband was there to physically carry me and support me.
Yeah.
But what I realized, it was I have zero core strength.
Mhm.
Throwing my back out made me realize there was nothing to support my back.
Exactly.
And that was my aha moment. And my chiropractor was like, okay, you need the next 4 to 6 weeks to heal this bad injury.
Mhm.
And then the first thing you need to start focusing on is core.
Core stabilization.
Yes.
Yep, absolutely. Yeah. So we have a bunch of muscles in our core that stabilize our spine and allow us to move safely. Totally, totally. And again, that's the story of the vast majority of people. And why wouldn't it be? Right?
Yeah.
It's like if it's not broke, don't fix it type of deal. But what's very clear to me being in the field, and I think a lot of my colleagues in the field, is that a little bit of prevention can go a long way.
And if you think about, since the beginning of time, we've been active, mobile people until fairly recently.
Exactly.
This sedentary lifestyle of sitting in a car and then sitting at your job and then sitting home and watching television, our bodies are not designed for that.
Yeah.
And so it's no surprise that we have all of these chronic ailments and conditions, and they are all connected. So, me throwing my back out is a core problem, right?
Mhm.
It's not. So what I find fascinating about your program, and so simple and yet brilliant, is that so often in our society, especially with older adults, we treat a symptom,
Mhm.
but we're not looking or treating the root cause of what's causing the problems.
Mhm.
So one thing, for example, people say like, oh, my mom received a dementia diagnosis.
Mhm.
Well, dementia is a symptom. What is causing the memory loss
Mhm.
or the confusion? What's the root cause of the dementia?
And when did it start?
Yes.
And what can we do about it early on? I mean, what's really exciting is all the research that's coming out about all these different ailments, specifically Alzheimer's and dementia, and how if we're able to address it really early on, we can change the trajectory of it. We can't necessarily eliminate it from developing, or I haven't seen data to support that yet. But if we can slow it down, all right, if we can push blood deep into the recesses of our brain and those vessels that might be starting to narrow and decreasing the amount of oxygenation our brain cells are getting, if we can start to improve that neurovascular flow, we can change the trajectory of dementia.
Let's talk about that. I didn't think we were going to go into the cognitive impairment world today, but let's do it. So as we're talking, so our brains are an organ. And
Mhm.
so what's good for our cardiovascular system, we know is good for our brain tissue and
Exactly.
circulation, but also our neuroplasticity, which has been proven when we improve our neuroplasticity, we minimize cognitive decline rates and dementia
Mhm.
symptoms. So I'm also thinking, as we're talking about this, learning a new skill is the quickest way to increase your neuroplasticity at any age.
Mhm.
It's the reason why stroke victims are able to regain ability and new.
Yes.
um,
I've seen amazing things with
Yes.
people who suffered stroke.
Yeah.
That was actually my favorite clinical rotation.
It's the best example to people to see, yes, your brain can learn new things.
Yep, totally. I mean, people that show up and they can't use half their body can walk again 4 weeks later by just, the constant training. And there's great research and new technology coming out to support that as well.
So if we think about this, not only when we're learning the new skill of these movement techniques through your program, we are creating new neural pathways
Mhm.
and new synapses in our brain to learn these new skills.
Yep.
So there's a physiological increase of blood flow and oxygenation
And
all those different
BDNF.
things.
Yep.
But there's also cognitively beautiful things happening in your brain.
Mhm.
So do it for the physical reasons, but the cognitive benefits here, I think we're onto something in this conversation about letting the world know
Mhm.
none of these things exist in a silo.
Yeah, totally. And I think specifically when you're working on balance training, that requires an immense amount of focus, especially, as you're acclimatizing to a new movement and using some of those reflexes that you haven't been training so often. Yeah, you're focusing, you're developing some of those new neural pathways, and you're improving your proprioceptive sensitivity, your neuromuscular sensitivity to perturbation, and a lot of good stuff is happening there. So absolutely, Erin, I think.
We meet so many people who say, some people are a little, and this good, they're clear that like, I am never leaving this house. My kids are trying to tell me to move into assisted living. I'm not going anywhere.
Yeah, rock on.
Yeah. Yeah. No, what I love about that
Yeah.
is that self-determination.
Mhm.
However, the best path to make that your reality is to stay strong
Mhm.
cognitively and physically. And
Mhm.
instead of saying like, have you seen the movie Up?
Yep.
Oh, it's such a great movie where
Yeah.
he like sits in his chair and is like, I'm not going anywhere. The best way to say I'm not going anywhere and I'm never leaving this house is to do the work
Yeah.
to stay physically, because you just mentioned falls.
Mhm.
Falls are the leading cause of, I think, death in older adults because of the cascade,
Yep. Yeah.
what happens after.
Especially hip fracture mortality. Yeah.
So you can stay independent, longer, healthier at home
Mhm.
by saying yes to increasing movement and some small codifications.
Yes.
Are you comfortable talking about falls a little bit?
Yeah, absolutely. So we know that 25% of people over 65 fall at least once a year. It's a huge number. It's a scary number, especially if we have people in our lives who we have been worrying about. I mean, my grandparents, for one, I'm very worried about them falling, and they have a short little movement program that they do to hopefully
Oh,
prevent that.
good.
Yeah, oh yeah.
My grandparents didn't want any advice from me, so I'm glad that yours take your advice.
Yeah, well, begrudgingly. The grandson has a little
Yes.
bit more pull than their
Yes.
daughter. Yeah, exactly. But yeah, so we know the risk is incredibly high, and we know that we can prevent falls through strengthening and balance training, right? There are three areas in our body and brain that are responsible for balance primarily. It's our visual system, our vestibular system, which is housed in our ears, and our proprioceptive system. And that refers to all these kind of sensory organs and our tendons and muscles around our ankles and knees and hips and even spine that allow us to receive the information telling us where we are in space. So, in other words, three different systems are telling our brain where we are, and the sensitivity of those systems is crucial in preventing falls. Because if we lose our balance, which happens to people who don't fall,
Mhm.
if those systems are acutely reacting to that, there's a much higher likelihood that we'll be able to correct that loss of balance. And again, training our leg muscles, training our ankles, training our hips to withstand perturbations increases the sensitivity of these systems and helps us stay upright. And that's one of the key areas we focus on with our programming because obviously we want to prevent as many falls as we can.
So that's built into most people's program is making sure that those basic areas are addressed
Mhm.
to help increase.
Yes. And it's not rocket science, right? Like I am not.
Simpler the better. So
Yeah.
explain that to everyone. This is not fancy maneuvers.
Yeah.
It's simple.
I'll tell you guys something. I took physics in college and that class took me to town. Okay. I am not an engineering genius type, right? What's become very clear to me is if we do simple things consistently and progress those things consistently, we're going to see positive changes that have implications on how we're able to function, right? So, to work on balance, all you really have to do is find a position where your body might feel a little bit unstable and just try and stay in that position. So, for a lot of people, it's a single leg stance, and you can do it with one finger on a counter, and then you can try and lift that finger up. And if you start to lose your balance, you can put it back down, or two fingers, whatever you need. As long as your nervous system and proprioceptive system is being challenged, you're going to see that positive adaptation. And when I was in school, I had this awesome neuro professor, and she called it the just right challenge. Shout outs to Karen Hutchinson. And all we're after is the just right challenge. And the just right challenge is different for every person. But by targeting that kind of outer limit of our capability, we're starting to see the adaptation.
So much
Yeah.
because we're all about less is more. What can be the
Mhm.
most effective?
Yeah.
Easy to accomplish,
Yeah.
keep people in the program. I
Mhm.
love the Just Right Challenge. We'll talk a little bit more about that maybe in another segment or within the Engaging Aging model because
Totally.
that's the goal. We don't want to share these like lofty big things that people can't execute on.
Yeah, we're not putting together a 45-minute program with
Yeah.
barbells and gyms and stuff. Unless you want that, in which case we will, because we have a few clients. I got a young man in his 20s. I got people in their 30s and 40s, but I would say about 60% are,
We have a client
60s,
in her
70s.
who just set up a full Pilates reformer
Amazing.
room. So yeah, it's whoever's listening, there's something for everyone.
Mhm.
So there's so much more that we could dive into on this, but again, manageable bites is our goal. Thank you so much, Dr. Kaplan, for joining us, and hopefully we'll see you many more times. How can people find you if they'd like to work with you or learn more about your program?
Yeah, thanks for asking. So you can visit our website. The company is called Enphysion Health, ENPHYSION.com or ENPHYSION health.com. And you can watch some videos of some of our clients sharing their experiences. You can book a free consultation, right? So we'll have a free 15-minute phone call. We'll learn a little bit about each other. We'll see if Envision might be right for you, or if there's another thing that might be right for you. We're happy to try and find that for you. We want to make you successful, no matter if you're working with us or not. And we have a YouTube channel as well with some exercises. So
We'll put some links in the show notes, everyone, so you can easily get in touch with Dr. Kaplan and his group. But thank you. And if you want a deeper dive as well, make sure you follow us for Engaging Aging.
Yes.
Where he will be the content expert for all things physical health. So thank you for joining us today. And thank you again for coming.
Thank you so much, Erin. That was a lot of fun.
Yay.
Good convo.
See you soon.
Sounds good.
Thank you for joining us today. We love having these conversations, and we hope they sparked something for you too.
If you enjoyed this episode, please like, comment, and share it with your community, because together we can change the way the world sees aging.
You can find us at dovetailcompanies.com or on any of our social media channels at Dovetail Companies.
And just a quick note, the opinions shared in this podcast are those of our guests and do not necessarily reflect the views of Engaging Aging, Dovetail Companies, or our team.
So until we see you next time, keep engaging with aging.